Good evening, sir. Myself, Shobha Patil, sir. I'm studying in MSc Microbiology 4th semester, sir. First, thank you our guide, Dr. Syed Baker, sir. Thank you, sir. Today's my topic is hepatitis viruses. Next slide, sir. So, hepatitis is a systemic disease with a primary inflammation to the liver. In the Greek word, hepat meaning liver, and titis means inflammation. Inflammation is nothing but infection. In hepatitis viruses, there are 5 viruses like hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Actually, I'm briefly explain hepatitis A, C, D, E, and full detail I'll explain hepatitis B virus. So hepatitis A virus, it is a infectious hepatitis. It is a subacute disease caused by eating food and drinking water infected with the virus called as HIV. HIV is nothing but hepatitis A virus. It can also be caused by anal oral contact during sex. It is of short incubation period like 15 to 40 days, and it is commonly seen in children and in adults with a swelling and inflammation in the liver, and it doesn't lead to chronic hepatitis. Then hepatitis B, it is also called as serum hepatitis. It is caused by hepatitis HBV. HBV is nothing but hepatitis B virus, and it is of long incubation period, that is 40 to 200 days, and it is more common in adults. It is spread by contact with the infected person's blood, semen, or other body fluids, and it is a sexually transmitted disease, that is nothing but STD. Hepatitis B can be serious infection that can cause liver damage, which may result to the cancer. Then hepatitis C virus, it is also called as transfusion hepatitis. It is caused by the virus HCV. HCV is nothing but hepatitis C virus. It spreads the same way as hepatitis B through contact with the infected person, blood, semen, and other body fluids.
ಒಂದು ನಿಮಿಷ ರೀ, ಇಂಟರ್ನೆಟ್ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದೆ. ಮಾಡ್ತಿದ್ಯಾ? Sorry for the inconvenience. Buddy. Sorry for the inconvenience.
Okay, sir. Okay, sir. Then, shall I start now, sir?
Buddy.
Okay, sir. The next one is hepatitis D, that is also called as delta hepatitis. It is caused by HDV. HDV is nothing but hepatitis D virus. In the presence of hepatitis B virus only, it spread through the contact with the infected blood, dirt needles, and unprotected sex with the person infected with the HDV. So hepatitis D can cause swelling of the liver. Next, hepatitis E virus. It is caused by HEV. It is causes swelling of the liver but no long-term damage. It is transmitted by oral fecal route and it can also spread through the oral anal contact. It is responsible for epidemic of hepatitis A, hepatitis in Asia, Africa and Central America. So briefly I explained about hepatitis A, B, C, D, E, and I want to explain full detail about hepatitis B virus because that is the most important virus. Here, hepatitis B is also called as serum hepatitis. So it is caused by virus HBV. HBV is nothing but hepatitis B virus, and it is long-term, long incubation period like 40 to 200 days, and it is more common in adults. It is spread by contact with the infected persons like blood, semen or other body fluids, and it is sexually transmitted disease, that is STD. Hepatitis B can serious infection that can cause liver damage which may result in cancer. So this is hepatitis B virus. So HBsAg means hepatitis B surface antigen. HBCAg means hepatitis core antigen, and it is also called DNA polymerase. And HBAg means hepatitis B envelope antigen. So hepatitis B clinical features. The incubation period of hepatitis B is 40 to 180 days or 40 to 200 days. Average is 90 days to 3 months. The clinical pictures of acute infection is almost similar to the hepatitis A. The onset is slow, usually insidious, but on the whole more severe than hepatitis A. The course of incubation can be divided into 3 phases. The first one is pre-icteric phase or prodromal phase. This phase starts after incubation period of 6 weeks to 6 months, characterized by malaise, fever, fainting, nausea, diarrhea, anorexia, chills, discomfort, or pain in the right upper abdominal quadrant. Some cases it may develop arthralgia, then mucopapillar rashes, polyarthritis, and glomerulonephritis. So second phase, icteric phase. This is after 2 days to 2 weeks of initial symptoms. Patients develop jaundice. The onset of jaundice and it is accompanied by darkening of the urine because of presence of bilirubin in the urine, and pale stools. Recovery normally takes 6 weeks to 12 weeks after the onset of illness. About 0.1% of the patients presenting with acute hepatitis B develop fulminant hepatitis with the death from the liver failure. Then third phase, convalescent phase. The phase lasts for long with the malaise, waiting for several weeks. Duration of this phase is more than 8 weeks to 10 weeks. In uncomplicated cases, but mild symptoms may persist for more than 1 year. Then the laboratory diagnosis for hepatitis B virus. Here, diagnosis can be achieved by detection of the various viral antigens and their respective antibodies by various sensitive techniques like ELISA. ELISA is nothing but enzyme-linked immunosorbent assay. Then latex agglutination, heme agglutination, and RIA. RIA is nothing but radioimmunoassay followed by the suppurative biochemical test. Here, antigen detection like detection of the HBsAg, HBcAg, HBeAg, and viral DNA polymerase. So hepatitis B surface antigen, that is hepatitis B core antigen, hepatitis B envelope antigen. Here, hepatitis B surface antigen, the antigen is detectable in blood, but about a month after exposure and reaches a peak level during the pre-icteric phase. Anti-HBCAG antibody appears in the serum soon after disappearance of hepatitis B surface antigen and persists of decades. Then hepatitis B core antigen, that is HBCAG. The antigen is not detectable in patient serum, but it can be detectable in liver cells by immunofluorescence. Anti-HBCAG antibodies often detectable at the beginning of illness, usually 3 to 4 weeks after appearance of HBsAg in blood and persist in the blood for months. HBAG, this antigen appears in the patient's blood, same at the time of time HBsAg appears. It disappears in few weeks and its persist in blood is an indicative adverse prognosis. Serum of such patients is highly infectious. Then viral DNA polymerase, it appears in serum during pre-icteric phase. So next slide. Then hepatitis B serum biochemical test, we can detect here serum bilirubin level, indicate degree of jaundice, then ALT, and the values range between the 500 to 2000 units in acute hepatitis. Then hepatitis B prophylaxis, we can go for a vaccination like active immunization. Following vaccines are available like HBsAg vaccine, plasma derived hepatitis B vaccine, hepatitis B vaccine, recombinant yeast hepatitis B vaccine. Dosage 3 doses are given intramuscularly and like 0, 1 and 6 months. Then recombinant hamster ovary cells hepatitis vaccine. Then passive immunization like hepatitis B immunoglobulin, single dose of 500 IU for adult and 200 IU for the newborn babies. Uh, Thank you, sir.
Thank you. Thank you, Shubha Patel, for your presentation.